Meet Betty, a medical provider working at a busy primary care clinic with integrated behavioral health services. Today, Betty is seeing Joseph, a patient with a recent hospital discharge for COPD and a history of depression and social stressors. Joseph is coming today for his hospital follow-up visit, and there are concerns that depression and stress are making it difficult for him to manage his COPD. Watch as Betty conducts a behavioral health interview to determine the severity and impact of depression in Joseph's life. The results of this interview will help Betty make a decision on whether or not to refer Joseph for behavioral health treatment available on site.
Joseph, so nice to see you today.
Nice to see you.
I was hoping today we could talk a little bit more about your mood and stress levels recently. So I reviewed your recent hospital notes, and I was glad to see you were being discharged. But it looks like you've had some mood changes recently, and then the screening questionnaire that you just completed, you screened positive. And this is a measure that we use to identify people who might be at risk for depression. So I was hoping you could tell me a little bit more about what's going on in your life, maybe things that are affecting your mood.
Where do I start? I've been struggling a lot. My daughter has been acting out at school, not acting right at home. It's been really stressful on me. It's been stressful on my marriage as well, my relationship. Been arguing a lot with my wife lately.
So it sounds like kind of everybody at home is struggling a little bit. How has this been affecting you?
Yeah, well, so like I said, there's just no energy. I really don't even have any care to take care of myself and my health, which has led to my hospitalization. So I've been taking my medications, been spending a lot of time alone by myself, and just kind of being isolated.
Yeah, well, I'm really glad you came in today. How else has the situation been affecting you?
Well, like I said, I never have energy. I don't feel like doing anything. I've been really frustrated. I really don't like being around people. And I hate to say this, but I don't even really want to be around my family even sometimes. I just want to spend time alone for the most part. So, no energy to even, again, take care of myself or take my medications and things.
So you've been spending a lot more time alone recently. What about the situation seems to be troubling you the most?
Well, I'm really worried about my daughter and that she's not doing well because of the way she's acting and the changes that she's experiencing have been troubling me a lot lately. Not so worried about my relationship with my wife because, we go through a lot of rough patches and we've been together a long time, so we always get through it. But I'm really mostly worried about my daughter.
So you're really worried about your daughter. I can understand that. With everything going on, how have you been handling this?
Not very well. I've actually not been taking my medication the way that I should, which again led to this hospitalization just recently. I've been arguing a lot, like I said, and then also I've even thought about smoking again, and I know that's not healthy for my COPD, so I can't say I've handled it very well.
It's clear you've really been struggling. Again, I'm really glad you chose to come in today. Can I ask you a few more questions just to get a better understanding of your health?
Sure.
Okay. So prior to your daughter struggling, have you ever experienced depression in the past or?
No, actually, I'm a pretty happy-go-lucky guy. Just until recently, the problems with my daughter and the combination with my COPD really did a number on me.
So you've been going through a lot. Yeah. Now, unfortunately, many people who struggle with depression have symptoms where they think about dying or they think about taking their own life. Has this been your experience recently or at any time in the past?
No, not ever.
Okay, great. So would you like to know about what I'm thinking?
Sure, yeah.
So it seems that you are suffering from depression related to your recent health issues and all of the stress that's going on. And people with depression or depression having it can make it difficult to manage chronic conditions like your COPD, sort of what you're describing. Fortunately, there are effective treatments. How would you feel about getting treatment for the depression and your recent stress?
I think that'd be a good idea.
Okay, great. Glad to hear you say that. So let's talk a little bit more about what that would look like.
Okay.
The behavioral health interview is an effective interview approach for quickly understanding the needs of your patient. The next step is for Betty to explain the integrated behavioral health services and refer Joseph to the on-site provider.